Hello, I'm Rod Grammer, founding board member of the City Club of Boise. Welcome to today's session on the WWAMI medical program. Thanks for joining us. I want to welcome our radio listeners who will be joining us later on a later date via Boise State Public Radio KBSX 91.5 and its affiliates throughout Southern Idaho and Northern Nevada. Today's forum is available for our audience in large part because of our City Club partners and sponsors. I'd like to take time to thank a few of these organizations that help us achieve our mission of ensuring compelling conversations, engaged citizens, and a dynamic community. Our premier sponsor is Northwest Nazarene University and NNU College of Business. Today's program is also sponsored by the Ada County Medical Society. We also receive support from the Forum Series sponsors, AARP Idaho, Bank of Idaho, Climate Tech Corporation, Echelon Group, Micron, Pacific Health Plans, Small Mine Development, and St. Luke's Health System. City Club of Boise receives grant funding from the Idaho Humanities Foundation. Also, thanks to our media sponsors, which include Boise State Public Radio, 670 KBOI, Idaho Statesman, and Idaho Public TV, and our university partners, the University of Idaho, Boise State University, and Northwest Nazarene University. Finally, I'd really like to thank the members of City Club of Boise, the individuals and organizations who understand that though the critical issues we face, the technologies we use, and the people who live here are ever changing, the need to find common ground and listen, seek shared solutions and learn, and respect each other is foundational to our experience as a community. Thank you for your support, and if you're listening today and not yet a member, I encourage you to join City Club of Boise today. Please remember that there will be an opportunity to ask our panel questions today via the Q&A function of Zoom. Just type your question in, or you can email morgan@cityclubofboise.org. That's morgan@cityclubofboise.org, and it will be provided to me. I'll do my very best to present each question and may group similar questions in the interest of time. Some of you may not be familiar with the acronym WWAMI. WWAMI stands for the states that are served by the University of Washington Medical School. The states of Washington, Wyoming, Alaska, Montana, and Idaho. For nearly 50 years, Idaho WWAMI has provided accessible world-class medical education through a partnership with the University of Idaho and the University of Washington Medical School. Today, I am joined by an expert panel to discuss the need to grow the Gem State's physician workforce, Idaho WWAMI's impact on our economy, as well as the experiences of these medical students and young alumni of physicians now mentoring the next generation of doctors for our great state of Idaho during this very trying time of the pandemic. Our first panelist is Dr. Mary Baranaga, Assistant Clinical Dean at Idaho WWAMI, based here in Boise, but raised in Midvale on a sheep ranch. She is also an alumni of Idaho WWAMI herself and the College of Idaho. Lucia Cabajaral is a first-generation Latina medical student from Weiser, who is practicing at the Terry Riley Clinics in Marsing and Nampa. Welcome, Lucia. Dr. Jaclyn Cooperrider, and also an Idaho alumnus and graduate of Eagle High School, is now working at the Family Medicine Residency of Idaho and Idaho Sports Medicine Institute. Dr. Lauren Nesbitt, also an Idaho WWAMI alum, is practicing physician in Twin Falls and Jerome. She is a native of the Magic Valley. And finally, Dr. Jeff Sigmiller, Assistant Dean Foundations Phase, Idaho WWAMI, and he is based at the University of Idaho campus in Moscow, as you can see there with the University of Idaho behind him. Thank you for joining us, everyone. Looking forward to today's conversation. Dr. Mary Baranaga, I'd like to start with you. You have gone through this WWAMI program. Can you explain a little bit, tell our listeners a little bit about what WWAMI is and how it serves Idaho, and especially our rural parts of Idaho?
Sure, thanks, Rod, and hi everybody. So first, I just want to clarify, I'm from Cambridge, Idaho. Midvale were our opponents in sports, and so we were a big rival. So I just have to clarify that. And it's kind of where Lucia and I grew up very close together. So anyway, I just wanted to clarify that. So what is WWAMI? So I think I want to just take a step back, Rod, for a second and explain the physician pipeline to make sure that we're all kind of on the same page. So in order to produce a physician that is licensed and able to practice for Idaho, it's a long process, it's a long pipeline. After K through 12 in college, medical students apply to medical school, they do 4 years of medical school, and then they graduate with their medical degree. But you can't go out and practice with just a medical degree. You have to complete something that's called a residency program in a specific specialty. And then once you complete that, you can become licensed to practice. The part of the pipeline that WWAMI entails is the part of the medical school. So as we talk about WWAMI, it's that part of the pipeline. So as Rod mentioned, WWAMI is a 5-state regional medical school. So one medical school for 5 states. It has kind of an interesting history. About 50 years ago, the governors of these states, and in Idaho, it was Cecil Andrus, got together and they were talking about, the challenges that they had providing healthcare to their rural states. And they really realized that in order to develop more doctors for the region, homegrown was the best way to do it. And so realizing that, in order to have a high quality medical school, it takes a lot of time, it takes a lot of money in order to have the educational and research infrastructure in place. And so they decided to collaborate, and out of that collaboration came WWAMI. So Idaho's been a partner, the state of Idaho, with University of Idaho and the University of Washington School of Medicine for 50 years. All of our students, so each class is made up of students from the 5-state region. Idaho has 40 students in each class. They come from all over the state. They do the first portion of their education up at University of Idaho in Moscow. And so they train in Idaho. And then once they've completed that basic sciences portion that Dr. Segmiller runs, the students have access to the 5-state region for their clinical rotations. All of the required clerkships that students have to complete are actually available in Idaho. So students can do the large majority of their training within their home state here, which we love. As they go around the state to towns such as Montpelier and Sandpoint and Moscow and Weiser and everything in between, they really get a taste of what it's like to practice in Idaho in communities that they may want to practice in the future. We have something called the Targeted Rural Underserved Track, which Lucia is actually a part of. And she may talk a little bit about that, where students who are really interested in rural and or underserved careers get matched with a community, and they get a lot of clinical experiences in those communities and see what it's really like to be a physician in those communities, to see if that's someplace that he or she may want to practice in the future. We've got a great track record for having students stay within our state and going into those very needed fields throughout the state, and really working on that kind of maldistribution of physicians that have happened. Our students pay tuition. The state pays a portion. So this is Idaho's public medical school, just like the law school or an engineering school or that sort of a thing. So these students are paying tuition. They're also paying into a fund that pays for our state loan repayment program, realizing the rural needs of our state. So Rod, does that cover it?
Yeah, that's a good overview, Mary.
Okay.
So there's a kind of a startling statistic, I think, that a lot of Idahoans may not know about, but I'd like you to comment on. Idaho is one of the most under-physicianed states in the United States. And I understand this is especially an acute problem in our rural areas. Can you explain from your perspective why Idaho is so challenged when it comes to the number of physicians practicing in our state?
Sure. Thanks, Rod. Great question. So what I would say is, in general, throughout the United States, there's a big physician shortage, especially in primary care. So it's not just an Idaho problem. However, it is very acute in Idaho. Rural states have sometimes difficulty getting physicians recruited and to stay there. And so that's why it's so important for us to get applicants and medical students from these areas, so they'll want to go back home and train. We've worked hard to try to remedy this with state loan repayment programs, et cetera. But what I would say is, even though WWAMI's been around for 50 years, for many years, we only had 15 students per class, and it was completely we rely on the legislature to fund it each year. And it started with 20, and then it was dropped down to 15 students per year in the late 80s, and it took almost 20 years to get it back up. Back in 2013, we started expanding to the current class size of 40, but that's actually not even enough people to replace the people that retire each year. The other key is, as I mentioned in that pipeline, is you've got to have residency programs. Just creating medical students does not create a workforce for Idaho. They've got to have a place to do their residency. And we know that that there's a very strong correlation to where people do their residency and where they stay to practice. And so that's why we've really been working hard to expand residency programs in our state. Right now, if you go into any specialty beyond internal medicine, psychiatry, or family medicine, you have no choice but to leave the state to do that residency training. And and a lot of people do end up staying where they do residency. Even the fact that so many of our folks have to go out of state to do residency, we've still had an amazing return on our investment with people coming back to the state. But I would say it's kind of a multi-pronged approach, Rod, and we're really working hard to increase the residency programs. But it's also a numbers game with getting folks into the residencies in our state.
Thank you. Dr. Sigmiller, I'd like to touch base with you on the first part called the foundations part. And I know that you're a key player in that at the University of Idaho, where WWAMI does have a great medical lab and also a really great medical facility. Can you talk about that foundations program?
Yeah, so for the viewers, the first 2 years of medical school, that's the fire hose part, where the students are really drinking from the fire hose, learning all of the basic sciences, working with true researchers and clinicians, and trying to prepare their foundation before they enter into the patient care phase, which is the 3rd and 4th year of medical school. So we're at a very critical part in the medical training. It's a very difficult and challenging time. And we've been fortunate over the many years to have great training sites in the WWAMI system. The University of Idaho is a great opportunity for our students to come and learn. I mean, we rank in the top most beautiful campuses in the country, definitely the most beautiful campus in Idaho based on BuzzFeed and other outlets. So there's some really cool things about being in Idaho. But of all of our great universities within the state of Idaho, University of Idaho ranks very highly in the top 100 public research universities in the United States. Yeah. And that is critical, because our students not only are learning about the basic sciences, but they're also engaged in doing research that impacts Idaho. And I think, it's a beautiful thing to start medical school in a rural town and have that opportunity to have a connection, to see real physicians practicing in a rural town. And the nice thing is we have students from all over the state of Idaho coming in and experiencing the Palouse and seeing what it's like to be a physician in this area. And then they're able to spread their wings after that foundations phase and really get out and experience the rest of Idaho, as well as the WWAMI region, because there's a lot of beauty within the WWAMI region. And I think about it, how does a medical school like University of Washington School of Medicine become a top medical school in the country? Because it is. It's ranked in the top 1 or 2 in the country for family medicine, primary care, rural medicine. And the way that that happens for over 20 years in a row is because of these great resources and these great public universities that make up WWAMI. And then when you add that piece in and you pull in some of the best and brightest students in the state, that's what makes the foundations phase, that's what makes WWAMI such a beautiful thing for the state.
Thank you. I would like to remind our radio listeners that you're listening to City Club of Boise virtual conversation featuring a panel discussing WWAMI, Idaho's public medical school, in partnership with the University of Washington Medical School. I'd like to ask our three doctors and our one medical student, what attracted you to WWAMI? Why did you want to become a WWAMI, go through the WWAMI program? Dr. Cooperrider, why don't we start with you? If you could tell us about your personal story.
Yeah, great. Thanks for the question. So I first heard about WWAMI when I was in undergrad. I was unfamiliar with the relationship that we had with University of Washington. So when I learned about it, I was thrilled because University of Washington is absolutely one of the premier medical schools to attend with a fantastic education. So for me, if I could get into WWAMI, which that was in some ways felt a little bit like a long shot, but if I could do it, that was 100% my number one choice. The other thing as I went through the process and started interviewing at other medical schools was really this emphasis on service and this emphasis on giving back to your community, as well as just the draw of being in a familiar place, both with physicians that maybe I'd grown up even going to. So there was a lot of reasons that I wanted to be in the WWAMI program, but I would say those are some of the biggest.
Thank you. Dr. Nesbitt, could you tell us your personal story?
Similar to what Dr. Cooperrider said, the University of Washington, at times it was kind of like the big dream, and I didn't know if I would be able to attain it. But the reason that it was the big dream was I would be able to practice in Idaho, and the people that I would be seeing would be the patients that I would want to see in the future, long-term wanting to come back and practice to the state. And then if you look up WWAMI alumni, it's not just Dr. So-and-so, it's Dr. So-and-so who is this community leader, or they're involved in this organization, or they started this nonprofit. So they go beyond just the medicine into kind of the heartbeat of the community as well. So all those factors that Dr. Cooperrider mentioned, and just having them be so integrated into the communities and have such a positive impact, was one of the big reasons that I wanted to go to the University of Washington.
Thank you. Lucia, what attracted you to WWAMI?
Sure, yeah. So when I was originally looking at programs for medical school, I knew that I wanted to find a program that really focused on working with underserved patients. Growing up in Weiser, we had one provider that spoke Spanish, and for me personally, that was a big thing that I wanted to help address within the Idaho physician shortage. And so I was specifically looking for that type of program, and happily ended looking at the trust program within WWAMI, which I'm a part of. And it felt perfect. It felt like that this was exactly what I was looking for. I'd be able to come back to Idaho because I'd done my undergrad in a different state, and but my parents still lived in Weiser. I wanted to come back home and be able to train in a place that I was close to and had grown up in. So yeah, and it ended up being a really, really good decision.
So Dr. Baranaga, thank you, Lucia. Dr. Baranaga, the application process for WWAMI is a lot different than it is for other medical schools, right? There's different things that you're looking at when you admit students there. Can you tell us what those things are?
Yeah, we do a holistic admissions process that really takes a look at the whole individual. In fact, so all of the interviews for the Idaho students are done by Idaho physicians who are part of the admissions committee. We do our admissions up at University of Idaho in Moscow. So the applicants get to come and see where they will be for the first portion of their education. They'll get to meet with the students that are there. And it really, Rod, you know, grades and MCAT scores are what I tell folks, those are things that, you know, are a portion of what is considered, but it really is who that individual is, what kind of a communicator they are, maturity, their life goals, that sort of thing. And so it's a much more holistic approach than many schools are. In fact, the physicians that do the interviewing are actually blinded to the applicant's grades and MCAT scores, so they can really get a sense of who the applicant is as a person. And so I would say that's one thing that sets us apart. And then the fact that the students get to interview with Idaho physicians, and they get to be where their foundation's campus will be when they do their interviews.
So it sounds like service and giving back, and especially serving some of our rural communities, are big factors. Is that right in the admissions process?
Yep, absolutely. And Dr. Segmiller can add into, so we look at leadership, we look at service, we look at, you know, jobs people have worked, realizing that medicine is a tough job. So, you know, I don't care if someone's worked at McDonald's for 3 summers in a row. That shows that not only were they hired back, but, you know, they know how to work as part of a team. They know how to deal with angry customers, et cetera, et cetera. So yeah, it's all of those sorts of things wrapped into one. We have a lot of rural applicants who, you know, they may not have all of the service trips on their resumes that some of the other applicants have, but, you know, they've come home and they've worked on the family ranch every summer, and what the experiences that they have had were very meaningful, and they really took a lot away from that. So all of that gets considered.
Dr. Sigmiller, WWAMI has a pretty good batting average when it comes to these students when they finish staying in Idaho, doesn't it?
Yeah, we have over 50% of our students will return back to Idaho. And I'll just kind of emphasize what Dr. Baranaga was saying, is that, you know, we have an obligation to the state. This is truly a public supported medical school. And so we have an obligation to the state to really help residents of our state be able to get into this program and also return and have opportunities to return back where Idaho needs physicians most. And, you know, over 50% is an amazing average compared to most medical schools, which is around 39%. But one of the limiting factors has always been the number of residencies that our students could actually go into after they finished the 4 years of medical school. But I would say, you know, this is a true great investment for our state. Every dollar that we put in from our state to this program, $5.10 comes back to our state economy. And that's amazing. And the way that math actually figures out is that Idaho physicians play not only a pivotal role in improving the health care of the individuals in our state, but they also create jobs, purchase goods and services, generate tax revenues. For, you know, all of our physicians in Idaho generate over $5.2 billion to our economy. And each physician that we bring back to our state, we know is going to, on average, create around 12 jobs wherever they're at in the state. So this is probably one of our truly greatest investments that we can do for our state. And it's a privilege to be part of it.
Thank you. I'd like to remind the audience, you can send questions to us in the chat, or you can send them to morgan@cityclubofboise.org. I would like to take, I've got a couple questions from our listeners that they're very curious. I'd like to ask this Dr. Cooperrider, Lucia, and Dr. Nesbitt. How has the pandemic been changing the way that you both are educated and the way you operate in the clinics that you're now serving? Dr. Nesbitt, would you like to go first on this one? How has the pandemic changed your work?
That's a great question. I started my first year of residency in the middle of the COVID-19 pandemic. So traditionally, patients that I would see throughout my day would be well and sick patients. Somebody coming in for a wellness visit, and then a little kid comes in with a cold. With COVID, we've actually separated our well side and our sick side of the clinic. So for a good chunk of my first year of residency, I was only seeing chronic problems or well visits. And now that the pandemic is shifted a little bit in the Magic Valley, I'm starting to see a few more acutely ill people. But it was a very interesting experience. First day getting N95 fit tested, making sure that we knew where all the PPE was. And I never thought that I would be checking somebody's COVID status. So that's been very interesting.
Yeah. Dr. Cooperrider, how has the pandemic changed your work?
Yeah, I think it's changed the focus quite a bit, and it's also changed to some degree the frequency with which I get to interact with learners, which is probably the saddest part about it for me. So as far as the focus is concerned, more of my job actually has kind of switched temporarily to helping with cardiac clearance for our BSU student athletes. So that's been, it's been interesting. It's definitely challenged me to think about it in a different way. And then as far as working with learners, there was definitely a period of time when I think we kept all waiting with bated breath. When is this going to calm down? When is this going to calm down? We'll have more learners when this calms down. I think we've learned and adapted now to be able to return to some sense of normalcy as far as our interaction with residents and medical students. And so that's been much better. But certainly for a period of time, I felt like I didn't get to have that interaction as often.
Yeah. Lucia, this must be kind of a challenging time for you as a medical student. Can you tell us about your experience so far during the pandemic?
Yeah, so everything kind of got more locked down, I guess I would say, when I was studying for my step 1, which is the first boards exam that we take as medical students. So, at the beginning, it was kind of not impacting us as much for those of us that were starting, I guess, finishing up our second year, starting our third year. But as things kind of kept progressing, we had to delay starting our third year clerkships for a few months. And then I had to reschedule my step exam several times and ended up taking it several months later than I was originally supposed to. So that was a stressful time, just trying to figure out, how can I keep studying without burning out, and retaining all of this information in my head for an exam that I'm not even sure when I'll be able to take. And then in terms of coming back into being able to work in clinics, we were all really excited to be able to come back in and see patients, but of course always a little bit timid and just worried about what this will mean for us going forward as medical students. And I'm just adapting to the differences in the clinics that we had worked in previously, now coming back to the same clinic and seeing a shift in how everything was done and adapting to that. So it was a little bit stressful, and it was definitely interesting, but I think we were all really excited and ready to go back to clerkships, or start our clerkships. So it's been a learning process for sure.
Well, on behalf of all the listeners, and I'd just really like to thank all of our doctors and medical students for what you're doing during this pandemic. You really are on the front line and really the heroes for the people of Idaho, taking care of people during this very difficult time. So thank you very much. I got a question here from one of our listeners, members, and maybe Jeff or Mary, either one you can tackle. And that is why do we only have 40? If we have such a shortage, why do we only have 40 students going through the WWAMI program each year? Is it a financial issue? Is it legislative support, or why do we only have 40? Who would like to tackle that?
I'd be happy to take it.
Okay.
And Jeff, please. So it's a funding issue. So, you know, we rely on state funding to produce the classes that we have. But even more so, it's more of a residency issue in that it's pretty, you want to make sure that the folks that you're producing, as far as medical students, the doctors that you're producing, that they actually have a place to do residency. And there is a nationwide shortage of residency slots. And it's tied to Medicare funding, federal funding, et cetera. And then in Idaho specifically, you know, if we're producing more medical students than what we have residency positions, we're a net exporter of physicians. Medical students don't automatically equal doctors in Idaho because those folks need to train. And so, you know, say they increased our class size to 200 all of a sudden, we would be a net exporter of medical students because they would be leaving the state, everyone to do their residencies. And then realizing that there's about an 80% chance they will stay in the area where they do their residency. So it has to be a collaboration with expanding medical student positions at the same time expanding residency positions, so you get that practicing physician at the end. So it's a pretty complex issue, but great question. And I don't know, Dr. Sigmiller, if you have anything to add.
You know, I'll just briefly add what Dr. Baranati was talking about is the ecosystem of medical education for a state. And you can't just grow one portion of the system without it having impacts or not doing something in another part. It has to grow together. And over the years, I think we've been very fortunate that our state has put resources into this public supported medical school, and it's not cheap, but it's truly one of our most vital resources. And it is an area that for the future, the way it looks now, we can't look this way 40 years from now. We will have to grow to meet Idaho's needs. And that's going to be the challenge, you know, the challenging question of the future of how we're going to do that.
If the country and Idaho in particular are facing shortages, and residency availability is one of our key things, and I understand Medicare funding helps pay for that, wouldn't it be prudent for us to have Congress expand the capacity of residencies since the whole country is facing medical physician shortages? Who would like to tackle that one?
I would just say absolutely. So back when the Balanced Budget Act was passed, that's when a cap was put on the number of residency positions at hospitals that already had residency programs. And because they thought that there was going to be too many doctors. And so that has haunted us. And so, you know, we have advocated to the, you know, Congress on this issue, especially for rural states like Idaho, to, you know, we really need a general surgery residency in Idaho. We really need a pediatric surgery in Idaho, et cetera, et cetera. So anyway, yes, I would say we need it. It's been an issue on everybody's minds trying to work on it. You know, at this point, people are trying to think outside of the box because it's been unsuccessful with our efforts to try to get Congress to lift that cap. But yeah, exactly. That's where the bottleneck is.
So just to stay on residencies for a second, we have one of our listeners wants to know a little bit more about residencies, like where do they conduct them? How long are the residencies? Can you touch a little bit on those more specific parts of the residency question?
Sure. And I'm just wondering, and I don't want to put anyone on the spot, but, you know, Dr. Nesbitt or Dr. Cooperrider, you guys are closer to residencies than I am. Do you want to talk about what residency was like as far as family medicine goes? And then I can talk a little broader as well. So feel free to. If not, I'm happy to take it.
Yeah, so Doctor, why don't I go to each of you? Dr. Nesbitt, maybe you go first. Tell us, like, where did you do your residency and how did that work?
So I am currently in my first year of residency at the Family Medicine Residency of Idaho Magic Valley Rural Program. So it's part of the Family Medicine Residency of Idaho, which initially started in Boise. My particular residency is in Jerome, Idaho, and Twin Falls, Idaho, depending on what rotation I'm currently on. It's 3 years long. Most family medicine residencies are 3 years long, and family medicine residencies are spread throughout the country. And there's several in Idaho, but I'm in the Family Medicine Residency of Idaho Magic Valley Rural Program in Southern Idaho, and we're the only residency program in Southern Idaho. If you go a little bit east, there's some. If you go up towards Boise, there's some. And then in Northern Idaho, there's also some.
Mm-hmm. How about you, Dr. Cooperrider? What about your residency experience?
So I went to residency at the Boise program, so the one that Dr. Nesbitt mentioned. And that program, also 3 years for any family medicine program. Typically, residency programs in general range from 3 years, sometimes upwards to 6 years, depending on the specialty. As far as where they're conducted, so like Dr. Nesbitt mentioned, they are in various locations throughout the state. They typically tend to be a collaborative approach between clinics, between hospitals. So for example, the Boise program, the residents are working inpatient at St. Luke's, at St. Alphonsus. Sometimes they're doing some surgery rotations at Treasure Valley Hospital even. Meanwhile, there are 5 different clinic sites within the Treasure Valley where the residents are rotating. And great news is that we did recently get another fMRI residency program in Nampa. So they had their first class last year, and they're a fantastic group of residents. So we're lucky to be expanding. And like Dr. Baranaga and Dr. Siegmiller have mentioned already, we need more of that. We need to see more of that, not only in family medicine, but also in other specialties like pediatrics, like surgery.
So Dr. Baranaga, this might be a question for you. Everybody's really interested in residency, so we're going to stay on that subject for a little while. There's a question here from one of our member listeners that can foundations or fund some of these residencies, or does it have to go through the Medicare funding?
Absolutely. So, and that's what has happened in places that have expanded is the reliance on Medicare funding and the federal funding has been a barrier, and so folks have looked outside of that. So some have gone after some state funding, they've gone after foundations, private money, etc. So yeah, it's kind of the whole range can happen.
Go
ahead.
I was just going to say, if we increased our funding, could we expand our residencies in Idaho, or do we have enough capacity in Idaho to expand them?
We do, and there's actually an effort with multiple stakeholders that is going on. It's called the 10-year GME expansion plan, and it's run through the Idaho State Board of Education. So back when Governor Otter was in office, he charged a group of folks to take a look at, you know, what does Idaho need now? We'd expanded WWAMI to 40. You know, where should we be putting our money and efforts? And this group came up with, it's time to really expand GME. So there's a very broad 10-year GME expansion plan that many of us are a part of that are basically working to get the state covered much better. And we've gotten state funding to help with that. So we're in year 3 of this working. And so, for example, that Nampa Family Medicine Residency is a result of that, looking at areas throughout the state. And so you can imagine Dr. Ted Epperly is leading the charge with us with this. And he has a great picture of the state of Idaho with sprinkler heads and then sprinkling the whole state with residents. And so, you know, over these years, the plan is to really increase it. But even with this very aggressive plan, we will still rank like 45th in the nation for the number of residents per capita. And so, you know, that's an example of a collaboration with the state, with the sponsoring institutions, and then private money to expand these residencies. But really, that blockage in federal funding needs to be blown up.
Yeah, and I understand that we're especially short of mental health professionals. Is that correct?
Yeah.
Which is kind of tough because Idaho has one of the highest suicide rates in the United States.
Yep. And absolutely. And actually, one of the new residencies that is coming on board as a result of this 10-year GME plan is a new psychiatry residency in Eastern Idaho, which is a collaboration between the University of Utah and Idaho State University. And then also expansion of the psychiatry residency that's based in Boise, that's a University of Washington collaboration with Idaho. So really working hard to increase the number of psychiatrists, because we know if they train in the state, they're likely to stay. And so we've actually had a lot of our WWAMI students matriculate into those psychiatry residencies.
I'd like to remind our radio listeners that you are listening to a City Club of Boise virtual conversation featuring a panel discussion about WWAMI, which is Idaho's public medical school in partnership with the University of Washington. Dr. Sigmiller, I'd like to, one thing that people may not know much about is that WWAMI is also involved in community health projects, COVID-19, opioid addiction. A lot of this is done through Project ECHO and AHEC. Can you tell us a little bit about that, those programs?
Yeah, I'd love to. You know, I think about the trajectory of creating a physician and then the learning that a physician needs and support that a physician needs beyond once they graduate from residency, finish residency, medical school and residency. And Idaho has some significant challenges. We are 16th in the nation for substance abuse, opioid-related deaths, and we're going down. But we still are above the national average. We have a higher suicide rate than the national average. So we have a lot of work to do. And so when a physician goes out to a setting, let's say Orofino or Cottonwood or somewhere in Idaho, there's a great possibility that they're going to kind of be isolated in their community or be the only physician in the community. And so, you know, what a medical school does is create not only training for physicians in the physician pipeline, but also training to connect physicians and give a resource for them. There are two programs. ECHO, which is Extension for Community Health Outcomes, is delivering programming both in behavioral health, opioid addiction treatment, and they're doing, and COVID. We launched after the week of our first documented death in Idaho to COVID, we launched a tele-education series for healthcare providers to get the latest information about COVID and how to deal with it. The governor even attended that first session. We had over 700 participants in that. We've had thousands now of physicians and other healthcare providers attending these things. Those are the types of continuing education programming and connection of a healthcare network and community that University of Idaho and Idaho WWAMI have been doing. And it's truly a beautiful thing to see a rural clinician bring a challenging case to a panel of experts, and the panel of experts give their advice, and then another rural clinician from another rural town says, have you tried this? You know, we don't have all of these resources, but this is what worked in my community. And so there is a body of knowledge that is created by Idaho physicians. And the reality is we need physicians in all parts of our states, all parts of our state. But the rural clinicians need that support so that they can see it a possibility for them to practice in some of our desperately, needed areas in Idaho.
We have a question here from one of our listeners that I'd like to ask our new doctors and Lucia about. That is, how important was the WWAMI program and the legislature's support for your seat in the WWAMI program to you from a financial point of view? And, you know, tell us a little bit about the financial situation that you all face wanting to serve Idaho's people. Dr. Cooperrider, would you like to start with that one?
Yes, you'll have to excuse me if you hear some little person noises. My daughter's making some noises right now. But
It is a joy. It is a joy to hear her. So
yeah, thank you.
thank you.
Yeah, so I think one thing that kind of doesn't get talked about often is the cost of medical education, and it has climbed drastically in the last several decades. So what we find is that a lot of medical students are graduating from medical school with upwards of $300,000 to $500,000 in medical school loan debt. And the beauty of WWAMI is that basically the state of Idaho is subsidizing our education so that we can get an in-state tuition price at University of Washington. So we're getting a top tier medical education for a public education price. And that's huge, because really, I think anyone who has student loans, regardless of where you've taken them out from, what degree you've taken them out for, knows that navigating student loan repayment is tough. It's really hard. It's intimidating. And so when you're looking at that coupled with this crushing amount of student loan debt, it just feels like an impossible task. And it definitely can turn people away from either the medical profession altogether or certain areas of the medical profession like primary care that are lower paying. So for me, it meant the world, and it really meant that I could pursue my personal dream of working in primary care in Idaho.
Dr. Nesbitt, can you touch on that? Tell us your personal story when it comes to how important that state support is and what your financial picture looks like.
I second everything that Dr. Cooperrider said again. I come from a very frugal family. I graduated with my bachelor's from Boise State without any debt. So the idea of taking on debt alone was terrifying to me. But knowing that I could get the best medical education possible for the best price possible was just another selling point for wanting to be in the WWAMI program. Another aspect is because so many University of Washington graduates do return to Idaho. Idaho has pretty good loan repayment programs that as students we pay into kind of as an incentive to have us return. So knowing not only was I getting an extreme value for cost, but then paying that loan off in the future would be more attainable as somebody who wanted to practice in Idaho. And that's unique to Idaho. Not every WWAMI school or WWAMI state does it in that particular way, but I am really appreciative that Idaho does. And people don't go to medical school and become doctors to become rich. We do it because we love people and we care about our patients. But the financial burdens are a part of our reality, and it's something that did weigh heavily on my mind when I was applying to different schools, and knowing that the University of Washington is one of the best schools in the country, and I could get it for an in-state cost was just incredible to me.
Lucia, can you tell us your story?
Sure, absolutely. So I, like Dr. Nesbitt, was fortunate enough to be able to graduate from undergrad without any debt, but I know that that is not the case for a lot of students. And so having, been able to go through college and accumulated debt, and then think about where you want to go to medical school and how much more in debt you will be, I know is something that's very daunting for a lot of us that we're trying to apply to medical school. A lot of my friends from undergrad who were already in debt. So I agree with everything that has been said. I think knowing that we are able to attend one of the best schools for medicine, for primary care, and have an additional bonus of it not costing as much as it could was a big factor in my decision as well. So it's very, very appreciated.
Dr.
And Rod,
Bergman.
I would just like
Yeah.
to comment, if that's okay.
Sure.
You know, one of the reasons why it's so economical to go through University of Washington as a WWAMI is by having 5 states share resources, it really keeps the cost down. So each state does not have to duplicate everything. So for example, if Lucia wants to go do a rotation in pediatric cardiology, she can go to Seattle and do that rotation without each state having to duplicate a big academic medical center in its state. So that, first of all, it brings the entire cost of the education down by having a lot of community resources involved with it. And then the other thing I would just remind people, and I think that the person who asked this question hit the nail right on the head, even at state medical schools, it is still way too expensive for people to go. I look at the average debt of our WWAMI students coming out, and they're still having to pay housing and, you know, living expenses, and people have close to $200,000 in debt. Could you imagine if they were at a school that didn't have, you know, reasonable tuitions, et cetera? And that's where Dr. Cooperrider's point out. I mean, there are some folks coming out of medical school in this nation with $400,000, $500,000 in debt, and you know, that they're probably not picking family medicine to go into. They're realizing how much time it would take to pay off their debt. And so it's a huge issue. And so, you know, these young doctors and medical students are not getting off scot-free. I mean, they're still paying a hefty amount of tuition per year, as is the state. But thankfully, the cost is down because of the sharing of resources that the 5 states do.
I just wanted to follow up that debt issue does affect students, what they go into. I understand a lot of students with a lot of debt try to go into specialties. So it sounds like it does hurt like family medicine and going out to rural Idaho and serving in rural Idaho. So this state subsidy is really key for solving our physician issue in a state like Idaho, right, where we have a lot of rural communities that need doctors. And if you're leveraging $400,000 of debt, that's pretty hard to do. Is that right?
Yes, I concur.
Yeah. So one thing I wanted to see if you could articulate is WWAMI is a very unique program in this country, this regional approach. Is it not? And do you think that this is going to become more of a model for medical education in the country, this cooperative model that helps keep costs down and where we can have Idaho students affiliated with one of the best public medical schools in the country? Either Jeff or Mary, would you tackle that one?
Jeff, you want to take it?
Yeah, I'd love to. Well, I'll just say, Rod, you're right. There's only one medical school in the country that has 5, 6 campuses, 3 time zones, is in some of the most needed parts of the country for physicians. There's nobody that matches that, and that happens to also create some of the most rich learning experiences as well. So it is a unique model. It's been published about as a quality model for how to do regional medical schools and campuses, how to create learning experiences across a very diverse region of the country, and to take students that have very diverse backgrounds in all of those regions as well, and help them come together and solve problems for our region. So it is truly a beautiful thing to watch when it works well. And for 40 plus years, it's worked really well. And so we're very fortunate that our state has had the opportunity to play a critical role in WWAMI and to really feel like we have ownership of it as well. I mean, this is truly our state resource. We're putting our money into it. We've chosen a university in the state of Idaho and training sites throughout the state of Idaho to help our students see that this is an investment that we want to have for a long time coming, and we want our students to come back and give back to the training of future physicians in Idaho. So it's a great partnership. It's a model for quality, and you know, it's truly one of the great things that I've seen our state do.
So I'd just like to remind our listeners that you're listening to City Club of Boise virtual conversation featuring a panel on the WWAMI medical program in partnership with the University of Washington. So I'd like to, we have a few minutes left. I'd like to have Dr. Baranaga and Dr. Sigmiller each comment on what are you seeing as the key challenges in the years ahead for WWAMI and for medical education in Idaho. Where do we go from here? And what do we need to do to move from 48th, 49th in the country to really truly serve the people of Idaho? Dr. Baranaga, would you like to tackle that first?
Sure, and a lot of this we've kind of talked a little bit about, but it's really growing the pipeline, the entire pipeline together. We need folks from rural and underserved communities, as well as places like Boise that are interested in going into medicine. So we need to be starting at the grade school level, recruiting these folks, you know, to think about medicine, and then fostering that interest, giving them support, getting them into college, and then, you know, making them realize, hey, I can apply to medical school and become a doctor, and then, you know, train them in our state so they don't have to come back. They never left. They got, you know, they stayed here and trained. And so I think that's really the key. And so, you know, I think really working with the State Board of Education and the state as a whole to grow those residency programs. And as the residencies grow, you know, consider increasing, you know, the WWAMI numbers. But I think that's the key, is growing the pipeline together and making sure that we are not a net exporter of doctors.
I like how you connected WWAMI at this end of the education continuum to K through 12 and how important those years are to get kids excited about medicine, science, STEM, and get them ready to excited about becoming a physician. Thank you. Dr. Sigmiller, what do you see as the biggest challenges ahead for WWAMI and medical education in general in the state?
Yeah, well, medicine changes every 14 days. And so we have to be prepared for that. We have to actually be ready to create state-of-the-art physicians that our state needs. We need our public to understand this is one of the greatest assets and resources for our state. When there's financial difficult times, we can't go backwards as a state and cut the number of seats of our most vital resource. So that's something that's always a worry in the back of our mind, because historically that's happened. And so this is truly Idaho's only public supported medical school in Idaho. And it's one of our greatest resources that we can't lose. We have to make sure that it continues to grow, that the whole ecosystem is not just healthy and strong and growing, but it's the best. And that's partnering with the University of Washington School of Medicine and our resources within the state and universities within the state, physicians within the state, hospitals and clinics within the state. That's what creates a top medical school experience. And it's just an honor and a pleasure to be part of that. And I hope the trajectory continues to go up, that we don't stabilize, that we continue to meet the needs of Idaho and hopefully meet the needs of our physician workforce in the future.
I'd like to give the final word to our wonderful medical students and new doctor. Dr. Cooperrider had to leave us, so I'd like to ask each of you, what is your fondest hope for your career as a physician? What motivates you? What excites you about being a doctor in Idaho? And what do you want to accomplish in your career? Dr. Nesbitt, would you like to start?
It's such a good question. The thing that drives me is just the patients that I get to see. They share these incredible stories with me, and just being in that part of their life is just such an honor. So long term, I want to stay in Idaho. It'd be hard pressed to drag me out of the Magic Valley, to be honest. But the patients and the people here are just so wonderful, and they're the reason that I got into medicine in the first place. So that's what gets me out of bed in the morning, is knowing that I get to interact with these just wonderful people every day.
Lucia, you get the final word on the panel. What do you hope to do in your career, and what motivates you and what excites you about your future as a doctor?
Yeah, thank you for the question. So as I had mentioned before, part of the trust program, I spent a few months in Nampa, Idaho, doing a kind of a more longitudinal program and working with several primary care specialties there, like family medicine and pediatrics and psychiatry. And the clinic I was working at there is called Terry Riley Health Services, and they have a very, I think, unique and interesting model. They're very focused on integrated care, very focused on service. And so I fell in love with the clinic, and I joked with one of the preceptors there that I want to take her job because it was so fun being able to experience working in Nampa, but then also traveling to the smaller clinics in Melba, Marsing, and spending time with patients there that were a little bit more complicated and didn't have as many resources there to be able to care for their needs. I was with a doctor who had done a fellowship in OB. So that is what I see myself doing. That's the goal, being able to go back there and spend time in all of the Terry Riley clinics. So yeah.
Well, thank you, and I'm afraid we're out of time, but I'd like to just say that this pandemic has sure made all of us non-doctors, patients that is, more acutely aware of how important your jobs are and how dedicated you are. So on behalf of all of us patients out there, I'd like to thank you for going into medicine and for your service in medicine, because we really need you. So thank you to our panel, and thank you to all of our listeners, and thanks for joining us today, and have a great afternoon.
Thank you, Rod.
Thank you.